What do you want to be when you grow up? That's such a common question we ask our children and our grandchildren, but it becomes a more serious question when you're in high school and the students are discovering more careers and skills that they're good at or things they really enjoy. So on this podcast, this is something you may want to share with the young people around you. Specifically, how about growing up to fix broken bones? It sounds exciting, challenging, and you will see in today's show, rewarding. Hello, and welcome to the Inside Scope, a podcast from Lakeland Regional Health. I'm Dr. Daniel Haight, Vice President of Community Health here at Lakeland Regional, and I have the privilege of hosting this podcast. With us today is Dr. Renee Genova and Dr. Heather Wortham. They are both orthopedic surgeons here at Lakeland Regional Health, and I think let's start off that, orthopedics about the bones and fixing the bones, but what are your specific areas of interest?
My specialty is orthopedic trauma, and I do also have an interest in limb deformity correction.
Excellent. So the trauma, because we're one of the trauma centers in the area, so you see the trauma and you have a particular area, Dr. Wortham?
I do specialize in trauma as well as Dr. Genova. We usually do general orthopedics, so I see a lot of aches and sprains in the clinic, and also I have a tendency to do a lot of foot and ankle trauma as well.
Oh, excellent. And there's a lot of bones to work on. And for a trivia question, for those of you who are listening, don't do an internet search, but how many bones do you think there are in the human body? And at the end of the program, we're going to also ask, what's the most bone that's broken? But the area of orthopedics, what really got you interested in orthopedics? What was your journey to become an orthopedic surgeon?
I was a career change. I used to sell the implants, so I was behind the table and really enjoyed being in the operating room and watching surgeons put the bones back together. And so I then went to medical school to become an orthopedic trauma surgeon.
Yeah, we're going to see, you brought with you some of the tools that are used and some of the implants that are used, but you mentioned that in the surgery, you got to see this early on, and you got to watch the orthopedic surgeons use the products to help strengthen the bones and repair that.
Yes.
What were some of your journeys to becoming an orthopedic surgeon?
Yeah, so in medical school, I actually thought I was going to become a family med doc. And so the whole time I got in, I thought I was going to be primary care all the way. And then third year, we had rotations that were required. And so when I did my surgery selective, it was orthopedics, and I was actually dreading it. I thought I was going to hate it. But after the first week, I loved it. I just loved the ability to see an x-ray and then fix the patient. And then they got better afterwards. And it just it hooked me.
That's the neat thing about high school, because I think they start to show the students different careers. And it's the same thing in medical school. We all got to have the opportunity to deliver babies, see orthopedic surgery. And that was one of the ones where, we tell the students, don't make up your mind right away. Get to see it early. What are some things that helped you sort of focus in on being an orthopedic surgeon? Were there certain things that you needed to do as you were getting your training in medicine?
And I was lucky because I went in my first year of medical school. I knew I wanted to be orthopedic and even trauma. So I got in with the orthopedic department at my medical school. And so that was very, very helpful from an opportunity standpoint and just an exposure standpoint.
Yeah, and I think it's those opportunities. We had a program here this summer. It was called the Discovery Program, where high school students came into the hospital 3 days a week. They got to see the paths that patients take from the emergency room all the way through the hospital and on the road to recovery. And are there programs out there like that gives younger people a chance to see what's it really like in orthopedics?
Yeah, there's actually the Perry Initiative that's out there.
Is that PERRY?
Yes, PERRY. It's getting high school students involved in a career in orthopedics early, at least exposing them to the different opportunities out there, and just seeing kind of what we do on a daily basis. And so that's so far that's had a lot of positive impact on the high school students.
Well, fixing broken bones, and I think the issue that you mentioned is that interest early on in seeing what's happening. Are there particular characteristics that a young person might say, I'm good at this, I like that, it fits with orthopedic surgery as one possible future? What are some of those characteristics that you find are really, really helpful?
I think working with your hands, and it's a very hands-on specialty, whether that's, that physical exam is very, hands-on, and it's a little more precise and involved in, each joint and each limb. And then, putting things back together and using literal power tools, splinting, techniques. All those things are really important to have, to want to be able to work with your hands.
I also noticed I had friends who went into dentistry, and they had to have a really good understanding of 3 dimensions because, having the tooth restored back to its original or close to the original. So you're describing if you have a broken body or a limb deformity, you're trying to get it back to the way it is most helpful and functional and pain-free. You tend to practice mostly at the hospital because of the trauma center. You see folks that are coming in by ambulance, but you have also folks that are maybe not as an emergency. Are they coming from our urgent care centers? Because Lakeland Regional has multiple urgent care centers throughout the community. Do you find that some of your patients are coming from there?
Yeah, so we have several urgent cares around the area. We have primary cares that'll see patients that have an injury, and then we also have that new freestanding ER. And so we get patients from all over the community, not just the hospital.
So right here in sort of the north part of town, you have the hospital and the emergency room, but there's the freestanding emergency room down on 540A.
Yep.
And so folks walk in there, they can diagnose broken bones.
Oh yeah, they have the same capabilities. They have X-ray, they have a CT scan, and they have the full complement of ER physicians there.
And so if they see a broken bone, and I think I have a relative, they had hand pain, didn't think it was a big deal, but the emergency room visit showed a broken bone.
Mm-hmm.
And then not an emergency, but something that you could then see in the office setting and that. So, and your office is on the Grasslands campus.
Yeah. So usually you just call, and then our schedulers will set you up. They'll kind of determine the acuity of how quick you need to get in. And so that's how they get you in the office.
Excellent. So they can stabilize it.
Mm-hmm.
When you think back to your careers and how it developed over time, did you have a specific role model that, because I think as you're in high school, you're so lucky if you have a mentor or you have somebody that sort of gave you some advice and it was beyond just the family, but someone that could really help you with your career. Did you have a role model, or is it at any particular point in time that happened?
Yeah, so on that rotation that I had that was mandatory ortho, that he was actually a hand surgeon. And so he's the one that kind of saw in me the potential to become an orthopedic surgeon. So after my first week or two with him, he really he would give me assignments. I would come in, tell him about the assignment that he gave me the night before. And then he just looked at me one day and he said, "You could do this." And I was like,
that is so,
yeah.
I'll tell you what, you can do this, because that's really all you have to hear, because it's a silent thing inside of you that sort of tells you you can do this, but you don't always believe that part of you. You get someone tell you.
I was shy too. I was a shy kid growing up. I didn't have much confidence. And so just having that person telling you that you can do it and that you have the potential was huge for me. So.
Oh, excellent. And anybody really make a difference through your career? Even I've had people even probably last month make a difference in how I approach it. Anything that's happened in you?
I had this really supportive teammates when I was a sales rep, and the surgeons that I called on, they were very supportive of it. And when I left the job, that was supportive. I had some supportive attendings in medical school, and that were very helpful. And again, gave me some opportunities so that I could be a competitive applicant. Yeah.
And I see how medical students go through and see different fields, and they think of orthopedics. But then you mentioned one area where it's the general orthopedics, or then you're having the expertise in trauma. But then there's different aspects of orthopedics, like the hand surgeon, that really is an expert.
Why did
in
you
that
in hand surgery?
Yeah. Right.
And I think there's other areas too. That, some of the orthopedic doctors love to work on the shoulders or knee replacements or how to deal with sports injuries.
Right.
And I think that's, to me, one of the more important areas where an athlete or even an amateur athlete wants to get back playing. But you probably have seen some serious sports-related injuries.
Yeah.
We may have to have a whole separate show on pickleball injuries.
Yeah.
Fortunately, not too many broken bones in pickle, but it's the outstretched hands, it's the falling.
You see it quite a bit, actually.
Yeah, I've come close to falling over the net. So that, and with tennis and other things, but you're trying to get folks back active. And it's not just sports. It's really the more serious stuff, getting back to jobs, getting back to your occupation. but to also be comfortable doing it. Your occupation might be sitting, but if you had an injury.
Yeah. I even have multiple patients who they're a little bit older, and they just said, I just want to pick up my granddaughter. And
Yes.
so just something simple like that. And they're so grateful that they can just get on the ground and play with their kids or something.
Head out to the amusement parks, be able to go on a walk.
Yep.
Yeah. Yeah.
Oh, excellent.
Yeah.
Yep.
And these are, our surgeries are often unplanned. And so it's not an elective total joint replacement. So, and that's also the difference of some of the specialties in ortho, that, joint replacement pathway is a little more
Regimented.
and not surprising. And we have a little, days that we kind of get surprises and we never know necessarily what we're going to do. And so some people don't like that, but they still like ortho. But you can have a very kind of planned out day and still do orthopedic surgery. And if you want something very, similar every day, that's still something that can be done within orthopedics. But if you want something that's a little more unpredictable and keeps you on your toes, then the trauma pathway is an option too.
Well, and being like an original, being a trauma center, we're seeing those. I'm curious, what is a day in the life of an orthopedic surgeon specializing in trauma? So what would be, and I imagine, an average day, and you may have two types of average days.
Yeah. So typically we're in the clinic 2 to 3 days a week.
Right. So you're not in clinic every day.
No.
So you have a clinic day.
Yep. So those are assigned days. Those are usually our more predictable days. So we go in usually when the clinic starts at 8 or 9 o'clock and then see our patients. The other days when we're in the OR, sometimes it correlates with the days we're on call. So when we're on call, that means that we're the person that the ER calls if there's an injury.
And you're waiting for the helicopter to land. You're waiting for the ambulances to...
And you're on call all day. So usually from 7 a.m. to 7 a.m. the next day. And so all through the night. So that's when most of your emergencies come in, is usually the middle of the night or in the afternoon.
Yeah, sure. You're ready 24 hours a day. It's part of being in a trauma center. And that's the part you said about the excitement of having this kind of career is the unpredictable nature. You never know what will be it. And then every case is an individual. Family might have individual concerns and questions. Patient might have pre-existing condition.
Yep. Yeah. I think it's very rewarding because you're, like you said, you're always on your toes. And so you kind of always, you don't really know what to expect. Some people hate that, but I love that unpredictability.
Plus the team you're working with, because if a trauma occurs, you have the orthopedic bone trauma, but you have the neurologic trauma. So you have your neurosurgeons you're close to. You might have soft tissue injuries and the abdominal trauma surgeons.
Yeah.
And so you see that team come together initially. And you got a great intensive care unit, our trauma intensive care unit. The team of nurses, they're keeping an eye on your patients. Yeah,
they're very, very good.
And then you're there in the hospital, on call 24 hours a day. If you can get in there, they'll let you know what needs to happen.
Yeah.
Oh, it's a great team.
Yeah.
You brought with you some of the tools that I see, and this is another thing. I think you said working with your hands and all that. What's this device right here?
This is a ring external fixator, so it's made of almost carbon fiber rings that are light, and multiple different rods and types of attachments that you can apply. And this is often used with wires that are placed into the body and attached to the frame. It can correct a deformity, like a crooked leg cannot become straight as it
you can adjust it.
We can adjust it. And so the angles and the three-dimensional deformity that the patient has, we figure out the way to adjust this so that we can really adjust the deformity.
So this could be for an arm or a leg.
It would be,
and it would be sort of in here, and then this would hold the devices that would my bones.
So wires would come into the bone and attach to this, so that as this moves, it's moving the bones it's connected to, and so you can make a crooked bone straight.
And that over time.
Over time, correct.
Isn't it amazing? The bones, I think a lot of folks think of Halloween and the skeleton, and it doesn't change, but bones change and grow. And how is that? Is that what causes a bone to have that kind of ability to adapt?
Usually bones like stress, and so like just walking when you're young stimulates the bone to grow. And so that's like what's really important. We notice it a lot too. If we have patients that are non-weight bearing for a certain amount of time, they actually lose bone mineral density. So your bone is very much an alive thing going on in your body. So,
and I also think about the folks that go into space and they spend months in space and they don't have that gravity unless they're actually forcing the education. I've seen where they've run on treadmills holding them down. When you think of young folks getting involved in medicine and healthcare, what are some other characteristics that you find like teamwork or communication? How does that play a role?
Yeah, I think you actually have to be a really big team player because you have to work with everyone around you, not only the OR staff and the clinic staff, but you also have to have really good communication because you have to be able to explain to your patient what's going on in like layman's terms so they understand it. And so I feel like that's really important to have good communication skills. And then also particular in our specialty, you have to be a really good problem solver because not every injury is the same. And so it's not just a book answer all the time. And so you have to be able to work through that.
Yeah, I think that's where if you're a student thinking about what career to go into, and if you like communicating, talking to people, being a part of a team, that's great. I like how you mentioned the problem solving too. But as you're following up your patients, say after a trauma, I like how you all ask, well, what matters most to the patient as they're going through this experience, or if they're coming to you for the first time because of an injury, and what matters most to the patient? What do you often find the patient telling you and saying what's important to them, or common questions?
I mean, I think it's actually super simple, and I think wanting to genuinely take care of people and get them better, they want to go back to work. Back to work's a big thing for most people, because if they're not working, they're not making money, they're not providing for themselves or their family. Getting back to their particular physical activity, if they're a runner or a cyclist, a climber, these are things that are on the front end of what they're wanting to get back to. And when am I going to be able to do this again? Am I ever going to be normal again? That's a big deal.
Yeah, because we were going to mention later a famous orthopedic surgeon named Ruth Jackson. She was the first orthopedic surgeon to be board certified, first female at Baylor in Texas. And she said, going back into her history, she got interested in orthopedic surgery for the exact reason you mentioned. She saw a father that could not keep employed because of knee problems. And to be able to fix that orthopedically was a huge issue, and being able to learn more about that.
Extremely rewarding.
It is. And I guess when I was going through medical school, I didn't know a lot about orthopedic surgery, but I always worried that, and I'm not very strong, I thought, oh, this has a lot to do with brute strength, being a doctor, really getting in there with these very hard bones. But y'all were describing it's more about finesse and expertise. Tell me about, is it strenuous, or is it more, just knowing how the body and the bones fit?
Yeah, I think it's actually a lot more finesse and meticulous than people give it credit for. So obviously there are some things that you need like strength to put it, like to mallet something into the bone to take it out.
Well, you mentioned you mentioned power tools. I imagine the use of drills and chisels and hammers, but also it's not just about strength. It's that kind of precision and finesse to get things back aligned the way they're supposed to be.
If you actually look at our team, most of them are little females. Like they're all like 5'5" or under, and so you definitely don't need strength to be in our field. It's more so just using your body in certain ways, so learning how to use the leverage to your advantage. And so it's not brute strength anymore. That was the old stereotype.
No, and it's not just about the bones. I think, to get to the bone, you have the nerves are in the area and the blood vessels. What are some of the challenges there in getting to that bone and knowing that there's other vital things around these bones, or the bones are protecting other things that are very important?
I had an attending that would tell me it's not a bony injury with soft tissue component. It's a soft tissue component with a bony injury. Because the soft tissue component is just as important. And you can fix a bone and x-rays can look beautiful, but if you don't have a good soft tissue repair or soft tissue coverage, it's essentially worthless. So wound healing, soft tissue status, we see open fracture where we have to address not just the bone. The bone is often the easier part.
So the open fracture is where you can see the bone
out of the skin.
It shouldn't be, yeah.
Right.
And that's one of the more alarming things. But I've always appreciated how calm you are when orthopedics comes in and everybody's very upset about seeing a bone that you're not supposed to see it. Your calmness and expertise to say, we're going to fix that, and it's going to be some healing. But you mentioned to me earlier about it's the whole person. It's not just the bone. You mentioned the soft tissue, the nerves, the getting the bruising and everything that goes in. My specialty is infectious disease, so infections of the bones. We've enjoyed working together to be able to say, here's how we make sure the whole person is doing well, and that
has joint mobility. The joints around both broken bones. It really is treating more than just the broken part. We want to get the functional component for the person back.
Yeah, and I feel like we have to know a lot about what's going on in the patient just as a medical standpoint as well. Because even though we're only dealing with the bones, we have to know what's going on a whole basis to know what their medical problems are, what their ongoing issues are. And so we have to know quite a bit more than just like what their injury is.
Yeah, I think like in their regional health and their community health is talked a lot about, being as healthy as you can be because something unexpected could happen. And you could have a car crash and you could be an out of control diabetic with, a heart problem, or you could be someone that's already seeing a primary care doctor. You have your medical conditions in check. And so if something, God forbid, unexpected happened, you're at least in better shape, with that. We talked a little bit about the team that you have. I've always been fascinated by your team at the clinic that puts the casts on the bones, because not everything is surgical. So some of it is needing just to be put in a cast so the bone heals itself. The team that you have there at the clinic that's putting the casts on, I've always been impressed how educational they are. They're explaining to these patients. Tell me a little bit about your other team members and those team members.
Yeah, our cast tech team is amazing, and they're wonderful. They love their job. They love educating. They know how important it is for the patient to understand, cast care, elevation, because those are the kind of things that are going to have
How do you scratch that inch?
Yeah, and they get that commonly.
and they've learned that's part of their educational component to the patient. Don't stick anything in your cast. And they have a printout for them, and they've got pictures of what it means to elevate the limb. Because if we can communicate to the patient appropriately so that they understand how important these things are, the patient will do better.
Because, I'm thinking of our younger listeners out there thinking about careers, and, at the max, there's the expertise and the hard work you've gone through to be orthopedic surgeons or in the healthcare, but there's these other support functions and your cast members that are in there putting the cast on. And I guess even the things that you might, to me, I've never had a cast personally, but how do you get that thing off? And I see that they saw it off, and I guess that would create a little anxiety. But you told me about a very reassuring way to tell folks about how do you get a cast?
Especially when I'm dealing with a kid. So we use an oscillating saw, so it doesn't actually cut the skin. And so usually preface it by saying this is going to be really loud. So just want to let you know that. But then I actually put the saw up to my hand, and they can actually see that it doesn't cut my skin.
So the saw just sort of
vibrates. Vibration tool, yeah.
And it takes off the cast, but it doesn't harm the skin and all that. But I like how you predict by saying it's going to make a lot of noise, and you get to say that's how it's going to do its job.
Expectation is humongous.
Exactly. How is the other team members? Who else do you rely on a lot in orthopedics?
In the OR, we actually rely on our OR staff quite a bit. They help our day run smooth. They help get the patients set up for surgery. So our scrub techs are phenomenal. And so those are the people in the OR that are actually handing us the instruments and getting the sterile field ready.
That's a cool job. I mean, because you can be working in the operating room in these different fields, but you could be working with belly surgeons, bone surgeons. They get to do a lot.
Yeah, you can see a bone surgery with us, orthopedic surgery, and then the next case may be a belly surgery, or they may be
that's a neat job,
an OBGYN surgery. So it kind of depends on the time of day where they get put, but then most of the time we like to stick them in one room most of the time, but they do see a lot.
Well, the orthopedic surgery that I saw recently, I was just also impressed, the team that was there getting everything going, helping the surgeon. There was also when there was an implant needed, there were representatives from the folks who know the most about the implants. And for example, these implants here, lightweight, but what's it made of?
So this plate's actually made out of stainless steel. So that is probably the most common metal that we use in trauma. And then these nails are actually made out of titanium.
Titanium.
Yeah, titanium. It's actually the closest metal to bone quality. So that's why we use nails for titanium.
And lightweight. And
it's good from a biofilm standpoint for infectious disease component of it.
So what kind of bone would this go onto?
That goes on a femur. That's for a distal femur.
So the long thigh bone. Yep. And so the long thigh bone, then this is going to add the extra strength as the bone is healing.
Right.
And then would these go inside a bone?
Yeah, so the bones are long bones, so like the tibia, the femur, they're all hollow. So these actually go right inside
the hollow part of the bone and add that inner strength.
Yep.
And then this you mentioned earlier is actually on the outside
of the body
with pins that go onto the inside and hold the bone. And then you said this was actually could be modified over time.
Correct.
And then how long would a person have to have this on if they're trying to get a bone straightened out?
It depends, but I mean, it can be up to 3, 4 months, 5 months. Yeah.
Yeah, to work with that, and a lot of education with it.
Yes, very much so.
We'd be remiss to not mention radiology. I mean, if X-rays are good for one thing, it's seeing bones, and that's for sure. And now with the CAT scanners, CT scanners, do you all see a lot of things in 3 dimensions now? Is that?
Yeah. So with the CT scan, you're actually given 3 different views of a bone, and so your brain automatically kind of forms the 3D image, but the computers can actually do that themselves now too.
Yeah.
And so not only are we kind of looking at the 3 views and kind of putting it together in our own head, but we can actually get a 3D rendering of it as well.
Oh, and so that really helps you plan the surgery. I think when you'd mentioned about just talking with the patients and you can show them, what's going on inside their body and ask them and really encouraging them, what kind of questions do you have? And we always ask, get your patients prepared and everything. Is there other team members that you rely on at the clinic? Oh, physical therapy. I think there's a lot to go on there. We talked about with some of our other guests, how they're integrated with y'all a lot at the clinic. You're at the Grasslands Clinic.
Yes.
On Hardin and Edgewood. Okay. Yep. Physical therapy is present there also.
Yeah, they're right across the building. Yeah.
And they're great. I have had therapists personally reach out to me about a particular patient, so we communicate, which I think speaks to how well we can take care of the patient from a team standpoint and make sure we're all on the same page.
I think too that physical therapy, it can we do the surgery, which is the initial recovery, but the physical therapists actually they're what determine the long-term outcomes a lot of the time. And so if you have a good physical therapist that's actually pushing your range of motion, pushing your strengthening, then you're actually going to do quite a bit well.
And the bones love that. The bones love the exercise, to being able to do it, but having both yourself and the primary care doctor involved, and what can the heart handle, what can the rest of the body handle, it gets all together.
Yeah. I think we'd have to mention our big staff of APPs, which are made up of nurse practitioners and physician assistants.
Yes. I think our patients get to know and develop what they feel is a healthcare home. And they see that in their primary care. But when they have an orthopedic issue, and some of these things you're helping the patient over many months recover, having that healthcare home, people that know you well, that makes a huge difference. So we had an earlier trivia question. How many human bones are there? Generally, how many bones are there in the body?
206.
206. Yeah, a lot. And I think there's even more when you're a baby. There's probably some of them are separated and they just sort of grow together. What's the most common bones that are broken?
For me, I would say I see wrists a lot. So disc radius fractures.
So many.
So you have the 2 long bones in the wrist and forearm, and then you got those tiny little ones in the wrist. Those take a long time. So you see the wrist.
Yeah, we commonly see, we call it the foosh injury. So fall on outstretched hands, so you fall on your wrist, and so we see that quite a bit.
I used to have a patient, he would fall a lot, but he wouldn't get injured, and he just said, well, I know how to fall. He was a basketball player, and he said he was 80 years old, but he said, I knew how to fall, and he mentioned, sticking your hands out, probably not a good idea, because you lose the function of your hands. That's probably one of the more challenging things, not just for physical therapy. There's something called occupational therapy, and that's how you just get through life. And it's not just occupation as a job, right? It's occupation on, like, how do you eat?
Yeah.
How do you go to the bathroom?
Getting a shower.
Taking a shower. That's orthopedic therapy. Oh, man, putting it all together. But it's so many different things. Well, we talked about if folks are interested in orthopedics, especially some of our younger folks out there, the Ruth Jackson Orthopedic Society. That's at least worth checking out their website. It's an organization for surgeons, but focused on women in orthopedics, but also medical students. But even if you're high school students, and need just to sort of check that out. But I tell you what, the impact you have with what you do with meeting individual patients, but today just sharing this and the excitement you have with taking care of patients, I think Lakeland Regional really has gotten the opportunities to bring students in, but to see what you're able to share with the community. We hope to have you back too to discuss some really cool things. Our audience can also share things that they're interested in, so we can get you back and ask them, what are the most common questions out there.
Yeah, too.
Wow, appreciate all the effort you do and what you do for our community. Thanks again. I appreciate all that you do.
Anytime. Yeah.